Once a child with autism has been identified as having the diagnosis, it's really important to get the appropriate intervention in place. For lower functioning kids or kids who are identified very early in their life, they need intensive behavioral intervention many times. And that intensive behavioral intervention is really crucial to their development, because we know that kids that get that intervention do much better when they're older. They become much more functional and the rest of their life. Some of those kids can even be mainstreamed into typical education settings where they need minimal or even no support to allow them to learn. On the intensive behavioral intervention side, you really want to focus on helping the child to communicate appropriately, helping them to interact appropriately, and helping them to learn. So for young children, you're going to teach them pre-academic skills. For example, just sitting in a chair appropriately, listening appropriately, making eye contact with the teacher. If they're in a circle time, responding to questions or back and forth. And for those kids, we know that that intensive behavioral intervention has a very crucial role in whether or not they're going to go on and be able to function at the level that we would like to see them function at. For example, studies have shown that kids who get early intensive behavioral intervention will oftentimes show very large increases in their IQ. Sometimes a full standard deviation increase, 15 points, maybe even larger than that in some cases. Whereas kids that don't get that kind of early intensive behaviorally focused intervention don't always show those kinds of big increases in their skills or their functioning. So this is an important part of the push that we've made for early diagnosis, so that we get this early intervention in place for the kids that need it. Not every kid needs, for example, a center-based early intervention. Some of those interventions will occur in the home. There are outreach programs, for example, that can go into the child's home and help them to set up a behavioral intervention program when they're younger. Also, school districts have become much more savvy about understanding the needs of kids with autism. And many school districts are starting to develop programs that are very much like center-based intensive behavioral intervention programs that can help the child to develop along the way, so that when they get to kindergarten or first grade, that they're able to participate more appropriately in those educational settings, whether it be in an inclusion classroom or actually in a typical or regular education classroom.